Hello everyone. Today we are going to learn about the ulnar nerve. So first we should learn what are the roots related to the ulnar nerve from which the ulnar nerve emerges. Okay. So it emerges from C8 and T1 of brachial plexus. So from which root? Lateral root of median nerve. So this should be the answer for the roots related to the ulnar nerve, right? Now let us go to the course of the ulnar nerve. What is the course? So we have written over here it emerges from C8 and T1. First we should draw. Then it will be easy for us to describe in words. We wrote C8 and T1. So the ulnar nerve is emerging from these roots C8 and T1. Okay. So after joining from these roots, the ulnar nerve is formed. Now the first region it has to enter is the axilla, the axillary region. Okay. So this is the axilla. The ulnar nerve enters into the axilla, and what happens in the axilla? It lies in between the axillary vein and the axillary artery. So imagine this is axillary vein and this one axillary artery. Okay, axillary artery, axillary vein, in between it is the ulnar nerve. Now after leaving the axilla, it enters into arm. So it is entering into the arm. Okay. Now in the arm, the ulnar nerve it lies medial to the brachial artery. So the axillary artery continues as the brachial artery in the arm, right? So the brachial artery should be in the lateral aspect. Brachial artery. Okay, I'll write full word. Brachial artery. Okay, this is in the lateral aspect to the ulnar nerve. This is in the medial aspect. Okay, so medially the ulnar nerve is present. Now it descends downwards, and in the middle of the arm it pierces the medial intermuscular septum, and then it again descends, and it here is a structure, small structure. It is known as the medial epicondyle of humerus. Medial epicondyle of humerus. So what the ulnar nerve will do? It will go behind the medial epicondyle, and when it goes behind the medial epicondyle, when we stand in anatomical position, we can palpate the ulnar nerve over there. Okay. So when we can palpate the ulnar nerve over there, it causes a tingling sensation. Tingling means a type of electrical type of sensation when we get hurt over the medial epicondyle of the humerus. So the humerus is called a funny bone. So an MCQ can come that because of which nerve the humerus is called a funny bone, it is the ulnar nerve. Okay, that causes this sensation. Now after this it leaves the arm and it should enter into the forearm. So it enters into the forearm. Now what happens in the forearm? When it enters the forearm, it passes between the heads of a muscle. If you consider this as two heads of a muscle, the ulnar nerve lies in between and it passes from in between the muscle. Now a question may arise, what is this muscle? This is flexor carpi ulnaris. Okay, and now after it passes through the heads, it descends. And what lies on the medial aspect? On the medial aspect, there lies a muscle which is called flexor digitorum profundus. Now, when the ulnar nerve is descending downwards, it is accompanied by the ulnar artery. The ulnar artery lies over here. It's accompanied by the ulnar artery. Now, before leaving the forearm, what happens? The ulnar nerve goes to the medial part of the flexor retinaculum. So, the forearm ends over here. So, now you have to enter into the flexor retinaculum. Okay. So, the ulnar nerve goes to the medial aspect of the flexor retinaculum, and at the distal border it divides into superficial and deep branches. So, this is superficial branch and this is the deep branch. So, first let us finish with the superficial branch. So, what happens to the superficial branch? It supplies a muscle. Which muscle? So the ulnar nerve divides into superficial branch and the deep branch. Now what happens to the superficial branch? It should enter into the palm. So a muscle should come related to the word palm, right? So the name of the muscle is palmaris brevis. It is palmaris brevis. Okay, and what else it supplies? It supplies the medial 1.5 digits. Means these two, half of this and this one, 1.5 of this. So medial 1.5 digits, right? Now what happens to the deep branch? When the ulnar nerve is coming, so it should come like this, like an arch. Okay, so if it goes from the medial aspect, so I have drawn a hand over here. It's horrible diagram. So consider this to be the thumb. Okay, this is the index, middle finger, ring finger, little finger. So the ulnar nerve is medial, right? So it's coming from here. So the deep branch, when it goes and becomes a arch, which finger comes first? The little finger, right? So the branches to the hypothenar muscle in our hand. This one is a thenar eminence, this is the hypothenar eminence, right? So in the hypothenar eminence, three muscles will be supplied by the ulnar nerve. One should be